My name is Madeline Christensen, and this is my case study oral presentation. So we were given a patient, Tony. He's 3 years old, and he's a male. The referral source and concerns. The parents called to make the evaluation appointment. The pediatrician stated that she's been trying to get them to come for 2 years. And the teacher was requesting that the child be evaluated because she feels as though she can no longer control him in the classroom. Tony is the only child of an upper middle class white married couple. Both of his parents are employed outside the home. He has a history of ear infections, 100 intelligible words, and the mother described him as a busy boy who has his own agenda. For pre-assessment and assessment procedures, the first one I chose was language sample analysis. The second one I chose was PLS-5, English Standardized Assessment. The third one I chose was a hearing evaluation. And the fourth one I chose was play-based communication assessment. For the first one, language sample analysis, I chose this because I really like this form of assessment. I like the assignment we did on it, so I found it to be beneficial. We did the assignment for a 47-month-old, and the handout that we had compared children all the way up to 48-month-old. So I think Tony is the perfect age to do this on as well. From this, you can find the mean language utterance, which can show where a child is at when you look at Brown's stages of morphological development, and I think this gives us a good baseline. I chose PLS-5 English Standardized Assessment as well. I chose this assessment because it is well suited for kids from birth all the way to age 7. Usually with kids this age, I would try to steer away from standardized assessments, but I do think that this one is beneficial and could give important information. I chose this because the test aims to identify receptive and expressive language skills in the areas of attention, gesture, play, vocal development, social communication, vocabulary, concepts, language structure, integrative language, and emergent literacy. I liked how this assessment covered a variety of things and could help determine strengths and weaknesses of receptive, expressive, and mixed language disorders. I also chose it because one of their concerns was his social interactions. So social communication was something that was evaluated in this assessment. So that's another reason I chose it. For the third one, I chose hearing evaluation. I chose a hearing assessment because I think it was important because of the history of middle ear infections. Ear infections can lead to hearing loss, and hearing loss can affect speech and language development. So this would be something to look into to see if it was causing and see if we can fix it potentially by hearing aids or some other device. And the fourth one I chose was play-based communication assessment. I chose play-based communication assessment not only because of its age, but because of his attention span. The teacher expressed concerns controlling him, so an interaction that isn't controlled would be ideal. His mother also said he tends to have his own agenda, which would make the assessment easier and more comfortable for him if it was just him playing rather than sitting down and having an interview. I believe you'd be able to get more information from an observation than an interview or other types of pre-assessments with this kiddo. Those are the 4 I chose. I think they're all equally important. I would start baseline with the hearing evaluation just to check that one off. But otherwise, that is all the assessments that I chose for this kiddo. And then this is the resource I've used for PLS-5. Thank you.